Hello, hello. Good afternoon, everyone. Myself, Dr. Prakhar Nyati. I have done my MBBS and MD Pediatrics from MGM Medical College, Indore. It is a prestigious medical college in the central India. Um, Currently, I am practicing as a child specialist in Indore. You can follow me on my Facebook page at Dr. Nyati's Pediatric Clinic, and you could visit my website, which is www.drnyatipediatrician.com. You can also download the Baby Chakra app, and you can see my videos regarding the care of baby. Today, I would be discussing a very important topic, and I would be clearing your doubts regarding the common top 10 common myths about newborn care. Okay. As a new parent, there would be very common questions coming in your mind that what is right for your baby and what is not. There would be many opinion about your colleagues, about your neighbors, about your elderly people in the house, that you should do this for the baby, you should do that for the baby, and you will be very much confused at which is the right thing which should be done for the baby. So I would be helping you with it. The first common myth that that comes to everyone my mind is that you need to clean the baby's cord with antiseptic and alcohol. No, the cord stem, that is the umbilical cord in the baby, should be kept cleaned and it should be kept dry. You should not apply anything on the cord. No oil application should be there. You do not require to apply any antiseptic or alcohol. You just have to keep the stump clean, and if if there is contamination of the stump with some urine or stool, you can wash it with some dilute mild soap. That's it, you have to do, and nothing should be applied over the cord stump. Now, what are the signs which are suggestive of infection of the belly bottom? The first thing is there would be redness, there could be swelling, there could be some sticky discharge or bad smell on or around the belly button. And secondary, the baby might have fever, may not be accepting feeds well, or could be keeping dull. So, if any of the above symptoms and signs are present, then you should consult a pediatrician. Now we comes to the second common myth that babies need to pass motion every day. First of all, we all should understand that a newborn is not will not behave like an adult. We expect that adult passes motion every day, and we expect the same from the newborn. So let it be very clear that a newborn can pass motion 8 to 10 times per day, or may pass motion only once during in 5 to 6 days. So both the things are normal. For a baby, passing motion 8 to 10 times per day is normal, and passing motion only once in 5 to 6 days is normal. We should not expect a newborn to behave like an adult. If the baby's motion is soft and the baby is passing motion once in 4 to 5 days, you should not consider it as constipation. It is a normal newborn physiology. Okay. And secondly, if you are fully breastfeeding your baby, then it is less likely that your baby would be constipated. Yes, formula feed babies may have constipation. Now, the second thing is that I've seen many parents asking me to use enema, and I don't know. They some are also using enema if the baby does not pass motion in 4 to 5 days. I must tell you that enema should not be used in babies. The baby could develop a habit of using enema and may get dependent on enema and will only pass motion if you use enema. So you should avoid the usage of enema. If the baby is passing high amount of stools around 8 to 10 episodes which are liquid inconsistency, and your baby is keeping dull, is having fever, and is not passing adequate urine, that is 8 to 10 times per day, and is not accepting feeds well, then these are the signs of dehydration. And for these complaints, you should consult a pediatrician. Now, the third common myth is that we expect babies to follow a routine. Now, let it be very clear that a baby is not a machine. We should not expect him or her to follow a routine from day one. A baby was in the uterine environment, was inside the womb for 9 months, and has come out and is trying to acquire himself with the outside environment, with the outside warm or cold environment. So the baby will require time. We cannot expect him to be awake in day and sleep in night. No, he or she will follow his cycle, and the sleep pattern and cycle of a young baby are different from those of an adult. And no two babies are similar. Sometimes we compare a younger baby with an older baby, कि जो हमारा बड़ा बच्चा है वो तो रात में सो जाता था, जो अभी हुआ है ये तो बिल्कुल नहीं सोता है, रात में सोने नहीं देता। तो नॉर्मल चीज है, दो बच्चे कभी भी एक जैसे नहीं होते हैं। सो नेवर कंपेयर योर बेबी विथ नेबर्स बेबी और even your older baby. And newborn babies don't have a concept of day and night, and every baby is different when it comes to sleep pattern. Some babies sleep through the night relatively quickly, while others take time to adjust. And the the thing which is basically a problem with parents, that they could not be having sufficient sleep, and this can cause tiredness, and this can cause stress in the mother. So basically the thing that we should understand, that we should not expect that the mother is a superwoman. She also requires sleep, so she should try to sleep with the baby. It is, मेरे लिए बोलना बहुत आसान है कि जब बच्चा सो रहा है तब आप सो जाइए, बट फॉलो करने में बहुत डिफिकल्टी रहेगी. इट इज वेरी डिफिकल्ट टू फॉलो इट, बट एटलीस्ट when the baby is sleeping you should take some rest. Now the fourth common myth is that picking up a crying baby will spoil them. This will spoil them. I don't know how some people believe that believe this, that you matlab, you cannot spoil a young baby. Crying is one way and the only way in which babies communicate. If your baby is crying, the first thing you have to do is to pick him or her up. The baby requires skin to skin contact with the parent or the caregiver. The babies require skin to skin contact. By crying, they are telling us, and crying is the language by which they are telling us their needs. And the second important thing is that the most parents nowadays expect babies to behave like adults from the time they are born. They think that for every crying there is a medical reason. No, babies will cry if they have fast urine or motion, if their diapers or nappy is wet. They will cry if they are hungry. They will cry if they are feeling cold, and they will require your constant care and attention. Uh, yes, if the baby is crying continuously for more than 20 minutes and is not keeping calm even after feeding, then definitely there could be a medical problem and you should consult a pediatrician. Now, the fifth common myth very of especially of the mother of the first born child is that they think that they are not having sufficient breast milk to feed their babies. So now the thing is that the breastfeeding is not a choice, it is a necessity as well as a responsibility of the mother. Colostrum, it's the milk which is secreted by the breast in the first 72 hours of life. It is yellowish color, thicker in consistency, and it contains high amount of immunoglobulins, which acts as the first immunization of baby and protects them from various diseases. So you have to feed your baby this colostrum, and you have to continue exclusive breastfeeding for first 6 months. Now, what are the clues of adequate breast milk production? First of all, the baby will gain weight adequately. For rough calculation, a baby will gain 30 to 40 gram per day after 10th day of life. Secondly, the baby would pass adequate urine, that is 8 to 10 times per day. Third, the baby will sleep after breastfeeding for at least 1 to 2 hours, and the baby would be active and playful. If these four things are present, then you should be very much confident that you are having sufficient breast milk production, and you should continue exclusive breastfeeding for first 6 months. Now, the sixth common myth is that infants need to be bathed every day. No, it is fine if you do only sponging of baby. If the temperature is warm and outside temperature is warm and the baby is enjoying bath, then it's okay to bath him or her daily. But if the temperature is cold, then it is better just to clean their face, neck, and diaper area, nappy area, and that is sufficient. And many parents nowadays are also thinking that oil massage is basically outdated and it was old custom. No, oil massage is very much necessary for babies. It improves the circulation and relaxation of different areas of body, and it tones up the muscles. So oil massage should be started after 10th day in each and every healthy baby. And the preferred oil should be either coconut oil or olive oil. Now, for mothers, in Indian culture, basically, there is a thing that mothers who are breastfeeding their babies should only eat bland food. No, it is not required that you only eat bland food. You should avoid spicy food because spicy food can cause diarrhea in your baby. And you should avoid alcohol and excessive amount of caffeinated bit of salt and spices in the food. There is no need to stick to excessive exclusive blend food. Um, Now the eighth myth is to give gripe water or janam guthi or applying honey. A big no. Applying honey can cause botulism in infants, which is a deadly condition. Giving janam guthi can cause diarrhea or constipation in babies because the babies have a very weak digestive system. They can only digest breast milk. If you are giving anything extra to them, it may either result in constipation or diarrhea. So all items except breast milk should be avoided. Now the ninth common myth, especially these days, is that bottle fed babies who are given formula feed are healthier. No, a cow's milk is made for cow's baby. Buffalo milk is made for buffalo's baby. Any other animal milk is made for that particular animal's baby. Similarly, human babies require human milk. This should be very much clear. Okay, so mother's milk is the only source of nutrition for the first 6 months of life. And the last myth is that applying kajal to a baby will make his eyes healthier, his eyes more beautiful, and will protect him from diseases. No, a baby's skin is very sensitive. It can cause skin irritation, redness, eyes infection. So all types of commercial products application should be avoided. Only thing which can prevent your baby from diseases is vaccination, and you should get your babies vaccinated as per the schedule. And we should remember that vaccine prevention is better than cure. Thank you. Let's start with the question and answers. I have a question that someone has asked, that can we use diapers? Yes, diapers can be used. The only thing that should be remembered is that while cleaning the diaper, you should, the buttock area, you should use very hands very softly, so that the friction is avoided. Because if there is friction, the diaper may be soaked in motion and there could be friction. Due to that, it will cause tear of the skin and it will lead to diaper rash. So that friction should be avoided. Otherwise, you can use diapers. There is no problem in it. Uh, Andra has asked the patient that I have delivered my baby yesterday night. Next to my ward, there is a COVID ward. So it is safe to breastfeed my baby. Yes, you should continue with breastfeeding. Even COVID positive mothers are advised to continue with breastfeeding. If the mother is having severe symptoms and is on oxygen, then only you should shift to formula feed. Otherwise, you should continue exclusive breastfeeding for your baby. Uh, Padma has asked that my baby is a premature baby. How should I take care of my baby? Now, premature babies require special care. They require sufficient warm environment. They are in risk of hypothermia. They require feeding um, at least 10 to 12 times in 24 hours every 2 to 3 hourly, because they are also at a risk of hypothermia. And only mother and father and a caregiver should handle the baby. They are also at risk of sepsis, so no other person should touch the baby. You should follow routine protocols like before touching the baby, your hands should be sanitized to prevent infection. These are the basic care which we should do. Uh, that the rat patches in the first 28 days of life are normal. They the baby's skin is very sensitive, and they can develop red patches. So I would suggest that you should not use any soap, any cream, or any powder during the first 28 days of life. You should only use either coconut oil or olive oil for massaging your baby. Other commercial products should be avoided in the first month of life. Common problems among newborns, there are very common problems I have discussed, that a newborn may not pass motion in 4 to 5 days, or may pass motion 8 to 10 times per day. A newborn may cry before passing urine and motion, and there could be skin rash in the first 28 days of life, and there could be frequent degeneration of milk. So, well, you can take normal diet during breastfeeding. There is no need of any uh, extra. You have to do normal Indian diet with little salt and very little spice will do. Well, as I mentioned, coconut oil or olive oil, no other oil should be used. Which oil is best to massage my newborn baby? The answer is coconut oil or olive oil. Well, the takeaway message is simple, that there are many rumors, many misconceptions, many myths, and many people will give you their opinion, but you should follow an expert opinion, and in any doubt you should always consult your pediatrician. That is the takeaway message. Thank you, everyone. uh, Please follow us on social media and Baby Chakra app, and get latest updates there. Thank you.